Hello, my name is Jamie Loomis. I am a student at the University of Texas, Arlington College of Nursing, taking the class Teaching and Learning Strategies. Today, you will see a skit where Socratic questioning is used in a teaching situation. Socratic questioning is a technique that requires student and instructor interaction. It helps to validate that the student has successfully understood the content that is being taught. It also allows the student to ask questions in a non-threatening environment.
Hi, Mr. Smith. I've got your IV fluids here. I'm going to hang these. And I was also able to get in touch with your doctor and got some pain medication ordered. So let me get this hooked up and we'll take care of that, okay? This is morphine. It's 2 milligrams and I'm sure that it's going to help you feel better really fast. I'm going to come in here in a few minutes and I'm going to check and see how you're doing. Thank you.
Hey Kim.
Hi.
I'd like to stop and just talk to you for a minute. As you know, we're getting ready for our Joint Commission survey, and one thing that they really focus on is their national patient safety goals. And so I'm just kind of wandering around, spending more time in the departments and making sure that all of our staff are understanding the patient safety goals and how we implement them. And so I saw with Mr. Smith you were giving him some pain medication just now. And I'd like to talk to you about patient identification today. So whenever you go in to give a patient medication, for example, with a morphine, how do you know that it's the correct patient?
I'm supposed to identify the patient with 2 identifiers. One of them is the armband, and I don't remember what the other one is.
That's okay. That's why I'm here, to make sure that all of our staff are familiar with the patient safety goals. So whenever you go in to administer medication to a patient, you're wanting to double check on the armband that the patient's correct name and then you have the patient's date of birth. Okay? So those are our 2 patient identifiers. Okay. So in addition to medication administration, what are some other times that it would be important to correctly identify the patient?
I would want to correctly identify a patient if I'm drawing lab or if I'm hanging an IV bag and also giving medications orally or through the IV.
Correct. Anytime that you're interacting with the patient is a good time to double check and make sure that you've got the right patient name and date of birth. When you're giving medications, hanging an IV, drawing lab, as you said. Also, if we're doing any procedures on the patient, we want to make sure that we have the right patient for the right procedure. So those are all very good opportunities. And why, Joint Commission doesn't just make up things for us to have to run around and do, and there's always a good reason for what we're doing as far as Joint Commission regulations and patient safety goals. So, as far as the patient identification safety goal, why do you feel that it's important that we correctly identify our patients?
I think it's important so that I don't do any harm to the patient. If I don't identify him correctly, then I could give the wrong patient's medications to another patient. I could give the wrong dosage to the wrong patient. I could do a lot of things to the wrong patient.
That's right. That's right. It's important because, it's a patient safety goal. It's a patient safety thing. And we want to, patients come into our hospital and they expect to receive the best care possible. And so we don't want to have any of those errors from the wrong medication going to the wrong patient, a tube getting mislabeled in the lab, and then having the results on the wrong patient chart. We've heard horror stories about the wrong leg being amputated.
Right.
So all of those things are, those are all very good reasons and why that it's important for us to make sure that we are correctly identifying our patients every single time.
I understand.
So thank you for your time. I appreciate that.
Well, thank you for telling me and teaching me more.
You're very welcome. So as you can see, Socratic questioning is a very effective tool for teaching. Socratic questioning can be used in many different learning situations. Nursing schools and healthcare facilities both can utilize this technique to ensure that knowledge is gained and also to enhance critical thinking skills. Socratic questioning does require interaction between the instructor and the learner. It also requires the instructor to be prepared with some open-ended, thought-provoking questions. Thank you very much.